good company. Today we have some good company.
Hi guys.
This is Troya. She is a dental assistant, and she's gonna tell us what it means. So Troya, first question: how do we know each other?
We met at Lowe's, which is our part-time job.
If you hide from the work, you're running from the money. So Troya, what is your job title?
I'm actually an EDA.
A what?
EDA. So EDA means expanded duties dental assistant. Same thing. I can do fillings, where a dental assistant would only clean rooms, suction for the doctor, that type of stuff, clean instruments. I get to actually do hands-on work. So that's the only difference. So if you need a filling, call me.
That's real.
I don't do any drilling though. The dentist drills and then I put the filling back in.
So what made you get into the field?
I hate the dentist. I hate the dentist. The dentist is so terrifying. I know. And I tell people all day, it's okay. You want to hold my hand? I hate the dentist. It's bad. I'm the patient that everybody talks about. That's me. So I was at the dentist getting my wisdom teeth pulled, and I was so nervous. So I was asking like 1,000 questions. What are you doing? I heard some thing over there. What is that? And the girl was laughing. She thought it was funny. I said, no, I'm serious. You just don't know how nervous I am right now. Like, I'm pitiful.
Yeah.
So I said, I probably could do this. It seems simple. So I went and signed up for school one day. And here I am.
What was the process? Like, what did you sign up with?
I went to ATA. So it was like maybe a 14-month program, maybe, give or take. So you take English, like a communications course, anatomy, just for like the mouth. And then you get more in depth into like the stuff that you actually do. So like x-rays, making dentures, that type of stuff. And then you actually have to go through a clinical so you can be hands-on. And then you have to get 300 hours in an actual office. And then you have to learn front desk, like how to take money, insurance, that type of stuff. And then work on the full patient.
So in the schooling, there was hands-on, like.
Yeah, so they had an actual dentist office that we would go to towards the end of the program, and we had to go maybe 3 nights a week. But the hard part was, say, for instance, if we were learning how to do a filling, you would do the book work on maybe say Tuesday, and you went to clinicals on Monday. But they had to split you up. So if you were already in the process of doing the x-rays or the fillings or whatever, you kind of knew what was going on, but the bookwork made sense when you got in class, but it was kind of hard if you were doing it backwards because they had to split you up, so it was kind of.
Is that school here in Louisville?
Mm-hmm. They actually have 2 schools here that I know of, MedQuest and ATA. They're like right next door to each other. And I went at night. No, well, I got financial aid, so I would say maybe.
So it does qualify for financial
Yeah,
aid?
so you do, yeah.
So
you
it's
can
like
apply for
higher education?
Yeah,
okay.
But it's more expensive because it's kind of like a private trade school, so. But they do dental, LPN, I think radiology maybe. They have different courses, so I mean you can choose and pick from whatever you know. So it's good.
All right, Troy, so tell me about some of the advantages of your career.
Well, you get to work with experienced doctors and hygienists. So if you do decide to go back to school to be a dentist or a hygienist, you're there all day. You're at work, you get to see. So I think it would be kind of easier when you go to school because you already know what's going on, opposed to deciding straight out of high school, okay, I want to go be a dentist or I want to be a hygienist. By me working in the office, I kind of know how it works. So that's a good advantage. So if you do decide, okay, I don't want to go to school right now, let me try this, good idea.
What's one of the disadvantages?
One of the disadvantages, our offices do not do the same work. So whereas you learn how to do fillings, you learn how to do dentures, you don't learn like the root canals, that type of stuff is more hands-on because you only work with like a dental form, like a model of a mouth. So you can only do so much, you actually have to have a person. So if you do decide to get in the field where you're pulling teeth, because you have, you can be an orthodontist in an orthodontic office, that's braces. You don't learn it in school. Extractions, you can go to an oral office. Pull the teeth, you can't pull teeth. I mean, you actually have to have a person to do a lot of the stuff that we do. So that would be a disadvantage. So it's best to, when you do go, okay, when you pick an office to do your training in, that's where you kind of be like, oh, I like this, I don't like that. I kind of get a feel of what you like and just roll with it.
So, I mean, that could be like a tip. It's like, go and see the offices before you make a
Before
decision.
you make a decision. Like, they do pick some offices where they want you to go. Basically, like, from the beginning, they give you like just a general office, which is just fillings, exams, dentures maybe. Some people do, like I said, you can go endodontists, they do nothing but root canals. So it's kind of
Hey, them root canals ain't no joke, though.
on what you can do. And I mean, some people I don't like root canals. It's boring to me. I like to glue it. So I rather be in an office where we can pull teeth.
Oh,
I like that part, yeah.
You like the pulling of the teeth.
Yeah.
Sheesh. What is your favorite part of the job?
My favorite part of the job would probably be the people that come in that are discouraged because their teeth or their smile is not like they want it. And then they get the bridge or the denture or whatever it is, and they can smile again. That always makes me feel good because we made them feel better about themselves. You know, that boosts your confidence. But some people don't like to talk or smile or laugh because they don't have teeth. And I mean, I get it. And it is very discouraging because you have to talk. It was kind of easier when the pandemic was going on to wear a mask, nobody knew.
Yeah.
So now people are starting to come back to the dentist and getting the grills fixed.
That is an advantage because I mean you get to. It's a career that you get to see the change.
The change, right? Or you get some people. Well, I want these pulled and I want this, and you let them pick. Okay, the shade look like this, or the gum will look like this, and they have different options as far as like the dentures. You can get come to me right now. A metal, like they would get a partial. It could be metal, it could be plastic. Like, so you get to explain to them how it looks, and then once they get it and see how they really look, that's what warms my heart. Oh, you didn't. Some cry, and I'm like, oh, it makes me feel like I really did something.
Do you guys deal with a lot of people who got like a lot of athletes like get hit in the face and their teeth fall out, or chipped teeth, or anything like that? Like,
Well, yeah, I mean, I've had people with, had accidents or well, like you said, sports or car accidents. I've had someone that said that he's been shot before. He was in a coma. So by him not being able to, and all the medications, like, I don't think people realize when you're sick, you take a lot of pills, it affects your teeth. Things that you eat affects your teeth, of course. Drugs. You have a lot of people that were on drugs for years and then they get clean and now they want to decide, I want to get my teeth fixed. So, I mean, it's a lot of different stuff that'll cause you to have bad teeth. Some stuff is hereditary. So,
I got good teeth. Hereditary.
Make sure you brush and floss. Floss, floss, floss. We can't stress flossing enough. And I'm guilty. I work in the office and I don't floss like I should. So
That flossing is serious. Huh? What's the best way to get into your field?
I guess just go sign up. I mean, if it's something that you're interested in, just make the decision on what you like to do and go for it. To each his own. If that's what you need to brush and you need to floss.
Speaking of flossing, is water flossing a good idea?
I have a water pick, and I like it, but it's messy because the water shoots out so fast. But it's good, like especially for people that have bridges or braces or permanent retainers. It's good because you can get. It doesn't get all the plaque. You still need to floss and brush, but it helps. They're expensive, but they're good. They're worth it. But it's worth the money. Yeah. So if you catch it somewhere on sale, purchase one.
So do you have any gum health tips?
Always floss. If you do drink sugary drinks, Mountain Dew is like everybody's go-to. I don't know what it is. Now, like energy drinks, sodas, anything sweet, really, use a straw. It doesn't really just hit, but if you drink through a straw, it's not really hitting the teeth. So drink with a straw.
Yeah, I never thought of that. That's crazy.
But always floss.
Straw. influence.
And brush twice a day.
So, Choya, if you had to give your words of encouragement to the people, what is your words of encouragement?
Do what makes you happy.
Blessings.
And if you don't know what that is, you might have to try a few things, but do what makes you happy.
Choya, what was your worst day?
It would probably be when COVID hit. That was hard. Because see, patients, like I'm just at work because nobody really knew, and we working them out. So we have to take extra precaution because we working them out. It comes from germs, so that was kind of hard at first. And then we had to have all this PPE, face masks.
But y'all continued to work.
We did, but we had to have like gowns and the face. We wore masks anyway, and we wore jackets, but we had to wear gowns, the face shields, masks. I wear the safety glasses anyway, and then we had to have like a humidifier. We had to have one of those in order to circulate because you're dealing with aerosols. So we're dealing with water and air all day. It's saliva and blood and everything. Airborne pathogens. So it was a lot.
Do you work in the dental office where they put people to sleep?
No. Never had to put anybody to sleep.
Okay.
I would like to see it though, but no.
How do you deal with somebody who comes in there and is like very nervous?
Well, that's my job to try to calm them down before the doctor comes in the room. Okay, now you're gonna get numb. Have to explain it to them, and they always ask, "Am I gonna get put to sleep?" That's always the first question. So no, we don't put people to sleep. It's just localized numbing with the needle. But hold my hand. It's like it's gonna be okay. Most people are like, "You want me to hold your hand?" And that kind of calms them down. Or close your eyes, take a deep breath. Always breathe through your nose. Do not hold your breath because I don't need you passing out. I'm not giving nobody mouth to mouth. I'm
fair.
CPR certified, but please just
That's fair.
don't hold your breath.
So I used to go to dental offices back in the day, and they used to let you put headphones in.
Yeah, you can listen to music. I told them to listen to your music, or I talk to them. Or play music. I would play music on the computer on my phone. There's something that you like to listen to, whatever that can
Distract you.
That'll distract them. But I think it's just the thought of being stuck with the needle that after you're already stuck, it's okay. But it's just the anticipation of the stick. It's like, oh Lord.
For me, it's more of knowing that somebody is in my mouth.
And then
like
a lot of people say they don't like the sound of the drill. Like there's something about the sound of the drill and the suctions that people don't like.
It's somebody being in my mouth and then me not being able to see what's happening.
That too, because you don't know what's going on. And you have to stay open for so long, depending on what you're getting done.
And then I always feel like my tongue's in the way.
That too, because you do get some people, and then some people produce a lot of saliva, and it's hard, and you have to keep the mouth dry when you're doing the filling. Like, you can't get it wet or the filling won't stick. So, you won't get it to hold. And that's a hard part for some people too. I need you to stay open, and I have to keep the suction in here. So, okay, it's a lot of cotton rolls and
it's a lot of stuff happening in there.
Going on, right? At one time.
I would like to say that I would like to see what's happening, but in reality, I know that I don't want to see that.
What's up? Ask them if they have a mirror and let you see the next.
Nah.
You just hold it up like this, you can look.
That's scary. So Joy, give us a day, what happens when you wake up and go to work till the end of your shift.
No, I work the front desk now, but I help in the back. But I have been in the back. I'm in a new office, so I work front desk. So this just consists of paperwork and answering the phone, making appointments, that type of stuff. But I like being in the back. I like being hands-on with the patients. That's where the fun stuff happens.
What's if you had to say which part of the job you don't enjoy, when you go into work and you're like, man, I hope this doesn't happen.
Probably the patients that complain or question the doctor. You came to the doctor for a reason. So they're not going to tell you anything that they don't think you should know or that you should do. They went to school for this. They know what they're talking about. So how can you question the doctor? You need the doctor's help. The doctor doesn't need your help. That's simple.
Fair.
I can't say it that way, but...
Well, yeah. It's kind of customer service in the same sense.
Right. You just listen to the doctor.
What are your plans and aspirations? What do you want out of this career?
considering going back to school to be a hygienist. I don't know how it's gonna work. I went once before when I started and I quit. So I'm thinking about going back. So
What's the difference? What's the difference in what you do now versus what
a hygienist is just strictly cleans teeth
Strict.
all day. Cleaning the teeth. Gum maintenance, teeth, that type of thing. That's it.
Is there like a different tier to what that is? Like,
So you have the assistants, which is what I do. We assist the doctors, and sometimes they do help the hygienists as far as like trying to suction that type of thing. And then you have the hygienist, which does all the cleanings, gum maintenance, that type of thing. And then you have the doctor, which does the drilling of the teeth. The diagnosis. Like we can't diagnose. Like I can read an X-ray and I can see what's going on, but I don't have the authority to be like, oh, this is what. That's not my job.
so it seems like the dental world is kind of the same as like hospital world. Like,
Yeah, you have your medical assistant, your nurse, and your doctor.
yeah,
Nurse practitioner or whatever, yeah. Same thing. It's just the math. Take care of your teeth.
take care of
Oh.
it. Oh,
When you have tooth pain,
okay. Uh-oh.
that's enough. Oh, I'm taking the leave or Tylenol. If you're in pain, most of the time there's an infection. So you need an antibiotic. Or people say, oh, I put Orgel on it. Orgel just numbs the gum. It does not help the nerve of the tooth. So if you're like in pain, or if you have like an abscess, you see swelling, most of the time you need an antibiotic.
Or gel is not a fix.
Okay.
Troy, thank you for joining us on Requesting Good Company. We are delighted that you joined us. That's what I meant to say.
Thanks for having me.
Because we're always requesting good company.